Welcome back to another episode of Reaction to the Pit. I'm so glad you're enjoying this content. I love making it and I'm learning so much. Make sure to watch to the end. Let's get into it.
Mr. Louis was found unresponsive and on the sidewalk next to fine wine and good spirits. Didn't we just discharge him a couple hours ago?
Yep, stone cold sober at 7 a.m.
Oh, God, don't light any matches.
Hey, Doc, how you doing?
Not as good as you, Louis.
What did you have to drink, Louis?
Just a couple of shots of vodka.
So like a half gallon?
Oh, hell no. Just a quart.
If you over-exaggerate your questions, you usually get a truthful answer.
That's
Best. All right, Louis, let's scoot it on over. You gonna guess the blood alcohol level?
Why would I want to do that?
I don't know, because it's fun.
okay. This is the endless revolving door of the ER. Like you push them out, they come back in. You push them out, they come back in. And there's actually a word that we use for people that are commonly readmitted. It's frequent flyers. Some of the most common causes of frequent hospitalization or rehospitalizations are heart failure, alcohol abuse, drug abuse.
What do you think, Dr. Devani?
Third degree. Complete heart block. No relationship between the P weights and the QRS bone complexes. Clear.
Heart rate is 30. What's low BP is going to make him a lot more confused.
Could cause a heart attack or a stroke if we don't fix it.
Oh, well, mystery solved.
The wires aren't even touching.
I'm totally disconnected. Shit happens.
Heart rate still in low 30s, no change with atropine. Pacing pads are on.
We can try. Willie, your pacemaker isn't working.
We're going to fix it.
We're going to try to pace your heart from the outside. You might feel it in your chest. Let's start at 10 milliamps, rate of 60.
Pacer on.
Oh, twitching.
No capture.
Increase to 20 milliamps.
That was more like a shock.
Still no capture.
Up to 30.
The patient is like giving his little things. That's cute. He's like, you better fix it. And he's like, more like a shot.
Oh, y'all trying to let
Pacer off. Can't tolerate it.
Shit.
Dr. Langdon?
One of verse said, can we set up for transvenous?
I was set up before you got here.
Shocking a patient hurts because you're literally sending electric activity through the body. Through the skin, through all of it.
Merced's on board. Willie?
Versed is it's an anxiolytic. It's benzodiazepine. It's midazolam. It's short-acting sedative. So you're kind of like still awake.
The pacemaker from your neck into your heart.
Where is that?
Because your heart rate is over 30.
And hit me with a shot at
You already had 3.
How does he know what atropine is?
Wait, are you a doctor?
I love when patients know this much about their own illness and they know what works for them and what doesn't and what they've tried and what doesn't. Atropine is a parasympathetic blocker, and nicotine, just because they both sound similar, and I'll help like kind of correlate the two. Nicotine is a parasympathetic mimetic, so it mimics parasympathetic nervous system. So you kind of heard about the two branches of the autonomic nervous system, the parasympathetic and the sympathetic. Sympathetic is like flight or fright. You know, it's like clench the butthole, run really fast, like be really scared about whatever's happening.
I think if we all just take a couple of deep breaths here and just try to...
And so like when shoulders are hunched and you're really nervous and stressed, you're in your sympathetic. And then if you take a deep breath, literally it's the best tool you have at your disposal at all times. You're so lucky to have it.
A little stress. So why don't we all take a deep breath?
Taking a deep breath brings you back to your body. And not only that, it flattens your diaphragm. An intentional deep breath, where you go, you take a deep breath in and then hold it. And then you let it out through your mouth. That activates your parasympathetic nervous system and it gets you to relax. And the reason I'm bringing this up is because atropine is a medicine used to pick up the heart rate, right? So it blocks the parasympathetic nervous system because you need the heart rate. We need the heart rate. Nicotine helps you relax, which of course that's why smokers love smoking, because it helps you relax, right? But you can also get that effect without the drugs just by taking 3 deep breaths.
Some help at home.
I think Rita could use a little break every now and then. We can't afford it.
Oh, Kiara told me about DHS Senior Phone Line. It's part of AAA, the Area Agency on Aging. They make referrals for in-home services.
What's that going to cost?
Medicare will cover short-term home care at least 10 hours a week.
Ginger, have you ever been to a senior center?
I went once. Nothing but old people.
AAA also has senior companions for a few hours a day.
So cute how old people call other people old people. This is such an incredible social worker and doctor who are spending time with the caregiver. We're going to give as much attention to caregivers on this channel as we can. Caregivers don't get enough support. There's some social media influencers who have made caregiving their niche to share and educate and promote. So here are some of the social media influencers that have made caregiving such a badass thing to do. We've highlighted the importance of it and how seriously it affects the patient when it's like a family member or a close friend or even a neighbor, as opposed to a stranger. I mean, either way, it is heavy work.
Program can deliver a meal.
Is everything all right? Did I say something that upset you?
No, it's all good. This is way more than I expected.
Passage is 30, just outside the heart. Why do we inflate the balloon now?
So it'll float into the right ventricle.
Exactly. We're looking for...
An injury pattern since it's below the AV node.
Looking good. Check the pulse.
So let's get into the heart's natural system, hardwired in every person's body, which is so incredibly fascinating, right? So it starts at the sinoatrial node, the SA node, that's what we call it for short. There's a small clump of cells there. That's where the nerve supply gets its innervation, and it stimulates an electrical supply, literally, from the SA node to the AV node. And from the AV node, it goes all the way to the bundle of His, which separates into left and right branches, and then that separates into the Purkinje fibers. So just like the branches of a tree, but in the beginning, it's not like a tree. It's like literally a direct line. Think of maybe like a constellation of the stars, because once that stimulates that, which stimulates that, then a rhythm is made. Side note, when your doctor's listening to you, don't talk while they're examining you because it's really loud. It gets amplified in their ears, and they're just like, ah.
I don't understand why you need me.
Crohn's disease status post-colectomy 10 years ago now with severe abdominal pain. Great teaching case.
Someone give me something for the pain.
Good afternoon, Miss Walker. I'm Dr. Garcia from surgery. This is Dr. Santos and Javadi. It's like you're in a lot of pain.
No shit.
We ordered you some morphine.
Did you read my chart? I'm allergic to morphine. I'll puke my guts out.
That's a side effect, not an allergy.
Okay, let's talk about it. Less a side effect, not an allergy. That's, I think, pet peeve for healthcare providers, because puking your brains out from morphine is a side effect. All opioids cause severe nausea and vomiting. If you've ever gotten like your teeth pulled for your wisdom teeth, or you've ever been prescribed any Percocet or Vicodin and felt really nauseous, that's because that's the side effect of the medication. The reason why it's important to distinguish is because, God forbid, you need the medication to save your life. It's good to know whether it's a side effect or a true allergy, because the mechanisms of what happens after or the treatments are totally different.
I'm dilated.
Okay, 1 milligram dilated.
I'll grab it from the PDS.
It's never enough. I need 2, sometimes 4.
Knows what she needs. So this is an interesting case. I mean, the first thing I think of, because I'm a bit jaded in practice, is like, is she pain-seeking? That's like a word that doesn't make sense in English grammar, but it should be like pain medicine seeking, meaning like, is she faking something to get pain medications?
Pertinent history, Javadi. Have you had any fever or vomiting?
Really good question, fever or vomiting, because she has inflammatory bowel disease, and those are divided into ulcerative colitis or Crohn's disease, and they both have a predisposition to their autoimmune disease. So nausea and vomiting could signify a bowel blockage, which could be a surgical emergency, which would be a reason to get a stat CT scan. Ultimately, with abdominal pain, more likely than not, you need blood work and imaging. So whenever someone calls me and they're like, I have abdominal pain, whether it's like a friend or a family member, or like a patient tells me I have abdominal pain, abdomen's a big cavity, right? So there's a lot of things going on in there. Some of them could be surgical emergencies, and some of them could be just like gas and like, you know, indigestion or whatever, or just like musculoskeletal back pain. So it could be like completely nothing, but it could be something. Fever, nausea, vomiting, those things for abdominal pain are really important to distinguish, like sudden onset, diffuse onset, what they think made it worse or better, or have they ever had this pain before. Those are really, really important to distinguish.
Eli, son of Willie Alexander.
Hey, nice to meet you. Likewise. How's he doing? He's doing better. He's gonna need to stay with us though for the pacemaker. He got a new one at Presby about a year ago. They said it'd be good for 10 years. Yes, but the wires separated from the box. It happens sometimes.
Kind of crazy how he just had a pacemaker placed a year ago, and now he's back because the wire's dislodged. So the way a pacemaker is placed is that it's placed in the heart muscle, like the electrodes.
Is everything okay?
Yeah. There's no infection in your uterus or ovaries.
Okay, that's good.
But your urine test was positive for chlamydia.
Shit.
It's a sexually transmitted infection. Any idea how that happened?
Yeah, my cheating piece of shit ex-boyfriend back home, but we broke up before I moved.
It's totally obvious that she's lying because at the corner of her mouth was like,
It's twice a day for 10 days. That'll clear it up. And he'll need treatment too.
If I don't tell him, is there a chance his tick will fall off?
If you don't tell him, a public health nurse will. You should also test for HIV, syphilis, gonorrhea, and hepatitis.
Okay.
let's educate on sexually transmitted diseases. First of all, they're totally preventable. Like most infections are totally preventable with hand washing, good hygiene, good education, and just being a responsible human. With that said, it happens. It's totally normal. There's nothing to be ashamed about. I want to educate you on the 5 STDs to ask your doctor for every physical exam when you're sexually active, even with the same partner. Just make sure every year in your annual physical, I recommend people get these 5 basic STD screenings, of course. Chlamydia, gonorrhea, syphilis, HPV on the pap smear, hepatitis C, and HIV. Those are super important to test for it. Chlamydia and gonorrhea are treatable with antibiotics. Long-term recurrent STDs, those two, can cause infertility. It's not shameful to get tested. It's actually really responsible. And it's not shameful to even ask your partner to show you their results with the date, with the results, everything out in the open before you get that intimate with them. Think about it this way. If you're old enough to have sex, especially without protection, are you old enough to, one, get pregnant responsibly, because that's how the babies are made, there's no other way. And then two, are you responsible enough to take care of yourself to not get a sexually transmitted disease? I recently worked at an HIV clinic, and I was surprised with how many 20-something-year-olds ended up with HIV, not from a place of shame or blame or guilt, but just they trusted, they were misled. They had no idea. And how would they know? HIV, it's super treatable, as we know, with antiviral medication. But at the same time, why get it if you don't have to, right?
Any other sexual partners in the last few months?
Not really.
Use condoms?
Most of the time.
It's important to use them all the time.
Yeah, but if I forget, you can just give me a shot, right?
Not for some infections. This is serious.
Yes, this is
Okay.
serious, girl.
It's good for 5 years.
This is serious. And she said, you could just give me a shot to treat it. And that's true. But also, there are some infections, they're not all STDs, but there's some infections that lead to cancers. And while I was studying medical school, I thought that was so interesting that these infections cause cancer. For example, I can think of 5 right now. So hepatitis C causes liver cancer. You can get that from nail salons if they're not using the right tools and cleaning them properly with the blood that comes out of the cuticles. You can also get them from tattoo parlors. You can get them from blood transfusions. You can get them from sex. So hepatitis B causes liver cancer. So does hepatitis B, and they're both transmitted the same way. Okay, but that's one category. Next is HPV. I lost a friend of mine who I went to high school with because she had HPV, and HPV is human papillomavirus, and it causes cervical cancer. That's why we recommend pap smears. It's a really common infection. The next bacterial infection, which is interesting because the first 2 were viruses, H. pylori, Helicobacter pylori, is a stomach bug, and it is transmitted by a fecal-oral transmission. Means the people who prepared your food either went to the bathroom, number 2, and weren't sanitary, and then didn't wash their hands, and then prepared food, and then you ate that food. That's how H. pylori is transmitted. It's also pretty common. It causes gastric cancer. Some of these infections are super preventable and they cause cancer. So let's do our best to employ proper hygiene techniques and not let another pandemic teach us how to be more hygienic. That's it for today's episode of The Pitt. We'll be going over the whole season, so be sure to subscribe. If you haven't checked out episode 7 yet, here it is.